The concept here is to try to centralize as far as possible the care, all of the care services that we're offering with regards to coronavirus. And if we do get over, as we get over this pandemic and we move into other phases, to probably modify this facility so that it can handle any infectious disease that might arise. Here in this facility, the plan is to handle at least three categories of persons: those who are infected and are suffering from the signs and symptoms of the disease, those who are infected but remain asymptomatic, and those who are in quarantine, who are waiting for their results, and who might have been in contact. And so there are three different levels of care that will be offered here. The facility is a modified facility, as you heard from the previous person. So we're looking to try to comply with all of the most up-to-date standards with regards to control of infectious disease. We're working closely with the ministry's standards department, but also with the engineers to ensure that everything in this facility will meet those standards to protect both the persons who will be using this facility, but also the staff who work here.
You had a walkthrough this morning with some other officials from the ministry. What are your thoughts based on what you would have seen thus far?
Well, the progress of the work has been commendable, to say the least. Uh, they've transformed the facility from what it was to where it is now. I think the quality of the work so far from the initial inspection seems to be um, up to date. We had some suggestions about a few modifications. Like with every medical facility, we'll have to cater for special services. There is a space for the operating room, there's space for a kitchen, laundry, um, waste management, area for the provision of all of the necessary gases, including oxygen, uh, the other kinds of the pharmacy, laboratory, and so on. So I think more or less those elements are there. Still a bit more of work to be done. And a facility like this will take some time, but hopefully it will, be ready for operation very shortly.
Um, an infectious disease hospital after COVID, which is going to be with us for a while. What happens after? You're going to bring these patients with infectious disease from all across the country here, or you still have departments at the various regional
The
hospitals
thing
and so on?
about the COVID is a respiratory infection at this point in time. It's spread by droplets, and along with COVID, there are other similar respiratory infection. We call them severe acute respiratory illnesses, SARI. Those come seasonally, like with flu, different episodes of flu outbreaks and other kinds of respiratory challenges. So I guess there will always be a role for a facility like this. Even if we were to get out of this pandemic shortly, we'll still have the need for a facility like this to help to, bring control. Um, the environment is suited in that it has the space, but it's also located, in a position where there'll be minimum exposure. It's not like in the case of Georgetown Hospital in the middle of a very highly populated area. There might be residents around, and of course, all the control measures will be in place. The system that the engineers are installing here will ensure that even the air, that is in this facility will be kept clean and free of any form of infection. I could see a broader role for even other infection control programs to um, be housed here too as time goes on.
And my question, would they see persons being transferred from other facilities to this facility? Um,
Likely, most likely, we will probably have specialists as we develop that capacity, those doctors and nurses and so on who can handle those cases more effectively, centered here. So it will be like a center of excellence for that regard, an infectious diseases center to address those needs. And persons who may be managed outside of this region or this area can also probably be benefited from the service here.
How long overdue is a facility like this in Guyana?
Well, we had facilities similar to this. Most of the persons will know of the Best Hospital, which was a sanatorium created way back, maybe about 200 years ago, when we were battling tuberculosis, a very devastating communicable disease that had a great impact on many of our particularly indigenous communities across Guyana. That facility eventually was converted to a general hospital, but the need still continued to exist. And even as the numbers of TB cases decrease, we still do have a need for persons with special, more complicated forms of TB that do need hospitalization. That sometimes we find it difficult to house them at general institutions.
So that will be done
So
here.
those could also be considered as we go along, since the facility will be, equipped with isolation criteria and standards.
Final question. In addition to TB, what are some of the other um, disease persons?
Well, I spoke about flu,
Mhm.
right? General influenza, severe influenza, bronchitis, bronchopneumonias. There might be some other, you never know how this is going. Coronavirus strains. There might be some other respiratory infection that may be resistant, for example, multi drug resistant forms of infections and so on, that needs to be really managed under this kind of condition. In our existing plan, each of the health facility across Guyana do have some level of isolation facilities, but after we started to look at them more carefully with the outbreak of coronavirus, we note that many of them were inadequate to handle the kind of highly infectious conditions.
Okay, my name is Oren Boyce, and the company represented is Aquasun Design Inc. Incorporated.
All right. Tell us about your interest in this project.
Okay. Well, overall, the project, the facility itself, is an hotel. It was originally a hotel, and we had to reconfigure a COVID-19 facility to in keeping with the international norms and standard, so as to retrofit this facility at present. Initially, we had some challenges in terms of logistics, but with the advent of everybody come together and working, we were able to solve some of these challenges and move forward. The the facility is busing. It is divided into eight lots. Namely, we have Mr. Ivor Allen, Mr. Jagman, Mr. Nicholson, and some other small contractors. And overall, I must say, a facility originally like this would normally take 6 months. And for us to bring it in a little over 3 months, it's monumental. And that comes about because of the collective and working with the doctors and the medical team and Ministry of Health and also the engineers.
Okay, just before you go, tell us about what were some of the challenges and how those were addressed.
Okay, some of the challenges we had in terms of retrofitting some of the rooms into, for example, this area here, this was a dining area. So we had to retrofit this into ICU, right? Which in terms we had to put in new conduits, new services, and also following the strict guidelines in bringing this project in terms of a COVID-19 facility.
Anything else you want to add?
I would just like to say I thank everybody for the opportunity, the team from health, my team on the ground. I would like to say thanks, and thanks to the PS and the minister for coming 110% on board